freestyle multiple-choice questions focused on Babesia from your listed text, including clinical features, diagnosis, risk factors, and treatment. Question 1, Diagnosis and Morphology. A 65-year-old man presents with fever, fatigue, and dark urine after a trip to rural Connecticut. He has no history of recent travel outside the U.S. Peripheral blood smear shows intraerythrocytic ring forms and tetrads. Maltese cross. What is the most likely diagnosis? A. Malaria. B. Ehrlichiosis. C. Babesiosis. D. Leishmaniasis. E. Anaplasmosis. Correct answer C. Explanation. Babesiosis presents with fever and hemolytic anemia, and the Maltese cross is pathognomonic on blood smear. Endemic to northeastern U.S., transmitted by Ixodes tick, same as Lyme disease and anaplasma. A. Malaria causes ring forms, but not Maltese cross, and is not endemic to the U.S. B and E. Tick-borne but no intraerythrocytic forms on smear. D. Leishmania affects macrophages, not RBCs. Question 2. Risk factors. A 47-year-old woman with a history of splenectomy presents with high fever, jaundice, and hemoglobinuria. She lives in Massachusetts and recently removed a tick from her leg. Labs show anemia and elevated LDH. Which of the following best explains her increased susceptibility to severe infection? A. Absence of hepatic Kupffer cells. B. Impaired neutrophil oxidative burst. C. Lack of memory B-cell response. D. Impaired clearance of parasitized RBCs. E. T-cell dysfunction due to HIV. D. Impaired clearance of parasitized RBCs. Explanation: the spleen plays a key role in clearing infected or damaged RBCs. Asplenic patients are at high risk for severe babesiosis. Why not the others? A. Kupffer cells are liver macrophages, not primary in this clearance. B. Associated with CGD, more relevant to catalase plus bacteria. Memory B-cell loss affects long-term immunity, not acute RBC clearance. E. T-cell defects predisposed to fungal and viral infections. Question 3. Treatment. A 38-year-old man is diagnosed with mild babesiosis after presenting with fatigue and fever. He is hemodynamically stable and does not have a history of immunosuppression or splenectomy. What is the most appropriate pharmacologic treatment? A. Mefloquine. B. Doxycycline. C. Atavaquone plus azithromycin. D. Quinine plus clindamycin. E. Metronidazole. Correct answer C. Atavaquone plus azithromycin. Explanation. First-line treatment for mild to moderate babesiosis is atavaquone plus azithromycin. Severe cases or immunocompromised may require quinine clindamycin. Why not the others? A. Used for chloroquine-resistant malaria. B. Used for Lyme disease, ehrlichiosis, anaplasmosis, not babesiosis. D. Used in severe babesiosis, not mild cases. E. Used for anaerobic protozoa like Giardia, not Babesia. Let me know.